Morning, everybody. Jeroen Weimar here. Quick update on the current coronavirus situation here in Victoria, update on outbreak, vaccination and a few other things, and then happy to take any questions at the end. It's been 4 weeks now since we started work on this, on a range of outbreaks here in Victoria. As we are now, after 4 weeks, we have 28 active cases of COVID associated with this community outbreak. All those cases, of course, are being well cared for. That is an increase of 1 in the last 24 hours. The new positive case is a primary close contact in the South Bank complex. Again, somebody who has been locked down now for a number of days. There are no new exposure sites from their exposure, and we're comfortable that they're all doing the right thing and part of that regular testing regime we have within the Kings Park complex. There are also 8 new cases today in the hotel quarantine system. Over the last 5 weeks, we've seen more than 850,000 COVID tests being undertaken across Victoria in support of managing this outbreak. That's an increase of 16,920 in the last 24 hours. 96.8% of those tests coming back within 24 hours. And again, let me add my regular thanks, but no less heartfelt, to all those people who have undertaken tests in the last few days and last few weeks to help us run these outbreaks to ground and to get them into such a strong position as we're in today. There are now fewer than 1,000 primary close contacts across our wider outbreaks. I'll provide some more numbers of those in a moment, with just under 10,000 people having now been stood down from being primary close contacts. So 10,000 people who have done the hard yards over the last few weeks of isolating, and my thanks to them for being part of this response, and just under 1,000 people still isolating at home as we deal with the remaining active fronts of these outbreaks. We've, of course, been particularly busy on the South Bank with Kings Park, and again, it's a very solid operation on the ground. My thanks to the residents. It's really come together well over the last week or so. Some really strong discussions have taken place, good support on the ground, a lot of regular testing happening in and around Kings Park, which has helped us to identify the new primary close contact who turned positive yesterday into today, in today's numbers. Obviously, a lot of work around supporting in-home testing for many of the residents in that facility. A very busy concierge service to make sure that we provide all the services to people that they need, and a very regular set of resident meetings to make sure that we're adjusting our approach as we go along. I can confirm we have around 451 primary close contacts associated with Kings Park, both within the facility, just under 200 residents, but also with the other exposure sites we've identified as part of the Kings Park response. I am pleased to confirm that we've now cleared 98% of the primary close contacts for the other parts of the outbreak. There are only 45 people left as primary close contacts for the city of Whittlesea, only 90 for Port Melbourne, and only 33 for West Melbourne. So those really are now to the very last few numbers, and we expect to release most of those people in the next few days. Just to change tack slightly, we are, so of course, now that as we start to progressively ease restrictions, we're seeing a lot more activity on the QR code check-in front. In the last week, 29 million check-ins on the Victorian Services Vic app across the state. That's an increase of more than 8 million on the week before. So again, my thanks to every single person who's touching in every day, frequently, I hope every day, with your QR code system. Obviously, we'd like to see that 29 million number continue to rise as we start to see more benefit of easing restrictions, but that's a very encouraging start. 190,000 organisations have now registered on the QR code system, and of course that number continues to expand as we move into those workplace settings as well. And also, in a very encouraging way, over 500,000 of those QR code touch-ins are using either the kiosk function or the add another function. So new functions released recently. Great to see those new functions being used so quickly and so effectively in the early days. Obviously, we are working very closely with our interstate colleagues on a number of small but always risky and challenging outbreaks in New South Wales and Queensland. And again, my thanks to those other jurisdictions for their ongoing close support, both through AHPPC but also more generally between our teams as we grapple with a common enemy across the eastern seaboard and across Australia. As we announced yesterday, the Chief Health Officer extended the orange zones in New South Wales. So there are now 7 areas in total in New South Wales, 7 LGAs in New South Wales, from which which are now declared as orange zones under the purposes of Victoria's travel permit system. So if you're entering Victoria from the city of Sydney, from Waverley, Woollahra, Bayside, Canada Bay, Inner West, or Randwick. So if you're travelling into Victoria from any of those LGA areas, you must obtain an orange travel permit, and on arrival you need to isolate here in Victoria, get tested and stay isolated until you return a negative result. It is so important, please, for those of us who are travelling interstate to abide by those rules, and anybody who is travelling interstate, particularly coming in from Queensland and New South Wales, please keep a very close eye on those exposure sites, on those orange zone areas, to make sure that you know what restrictions you need to comply with. It is through the strong response on the ground that we're seeing in our sister states and supporting that work by the work we do here in Victoria that collectively we try and keep Australia as safe as we possibly can. In terms of vaccinations, look, I think we all welcome the renewed sense of urgency we're seeing around the place, around really picking up and maintaining the excellent momentum we've seen here in Victoria on the vaccination program. As we said last week, our real focus this week is on ensuring that those second doses start to get delivered, and we're really encouraging anybody who's had their first dose of Pfizer, make sure you have your second dose booked in. Anybody getting their first doses now will be asked to book in their second dose at the clinics. Last week, we completed 30,000 second doses of Pfizer in our state clinics. This week, we have another 50,000 people booked in for their second doses this week. However, there are more people that are eligible for their second doses now, both last week and this week. We'd ask them please to come forward and get those second doses booked. You can do that online. We are holding reservation slots. We have vaccine available to deliver those second doses. We're really keen to make sure people stay on time with their dosing schedule. Similarly, for those who have already had Astrazeneca, if you've had your first dose of Astrazeneca, like I have, then please make sure you come forward for your second dose when the time is right. Again, the ATAGI guidance is very clear. For those of us who've had the first dose of AZ, whatever our age, we really are encouraged to make sure we get our second dose 12 or so weeks afterwards. We're very keen to make sure that those who've started the vaccination journey complete it, so we can all keep ourselves safe and keep the rest of our wider state safe. Look, we've come a long way, I think, in the last 4 weeks. I know, and I'm so grateful to all Victorians for travelling with us over those last 4 weeks. We have some more work to do on closing out this remainder of the outbreak. And as we can see from our interstate colleagues, we're never completely out of the woods. But my thanks really for their support so far, and I'm happy to take any questions.
Mr. Weimar, just on vaccinations, how many extra doses per week do you think we need in Victoria?
Oh, look, I mean, to some extent, it's how long is a piece of string. We've seen over the last 4 or 5 weeks that Victorians want to get vaccinated. The revised guidance from ATAGI makes more Victorians eligible for the Pfizer-only vaccine, and that's where the real pressure is at the moment. Look, we were vaccinating 80,000, 90,000 Victorians with first dose Pfizer until a couple of weeks ago. We're more than capable of maintaining that momentum. We will have to ramp down to around 40,000 first doses from the beginning of July, in line with the schedule we have. And look, if more Pfizer were to be available to Victoria, we will be able to lift that to more than double that 40,000 a week of new first doses. But look, we're working well with the new team in Canberra. We are starting to really get to the brass tacks of understanding how much vaccine is available, and not only how do we plan over the coming weeks, but how do we plan all the way through to the end of the year. It's a huge challenge, and the focus here in Victoria has always been, let's get as many people safely vaccinated as swiftly as we can, and any doses that are available, we will gladly use them.
So is that an extra 40,000 a week, you're saying?
Look, certainly, I think we all recognise there are real constraints in terms of national availability. I think what I would say is if there's an extra 40,000 doses available a week, we would absolutely take them, because we can put them into people's arms now. If there was an extra 100,000 doses available every week, we could put those into people's arms now. We have the infrastructure and the capacity to go and do that. Look, we are working closely with the Victorian GP network, and we're working closely with the Commonwealth to find the best possible way through this. But fundamentally, it's about, if the vaccine is available, we want to get it into people as quick as we can.
Is it frustrating that we're going to be dropping to 40,000? Is it frustrating from your point of view that we're going to be losing that momentum?
Yeah, look, absolutely. I think we're all. I think all of us are now seeing the benefits of vaccination. If you look at this particular outbreak, I mean, we've had over 101 cases. We've had 3 people, I think, in total hospitalised through this outbreak. We've not lost a single Victorian through this outbreak, and that's the value and the power of vaccination, because some of those most vulnerable people have been vaccinated and who have been impacted by this outbreak. So we want to maintain. We've all seen what Jeff shared and what the exhibition building looks like when they're full. We want to maintain that momentum, and if the vaccine is there, we want to make sure we keep getting on with it, and we don't want to do anything that puts the brakes on this thing.
Do you agree the vaccine rollout has been a shambles, and what are you hoping to get out of National Cabinet today?
Well, I'm not National Cabinet, so I'll leave it to the acting Premier to make the arguments at National Cabinet. Look, I think we're all frustrated that there's not more vaccine around. I think we've demonstrated here in Victoria, between ourselves and the GPs, that we can vaccinate 1/3 Victorians every single week with a number of different vaccines across first and second doses. We would like to maintain that momentum. I know the GPs I've spoken to are keen to maintain that momentum, and it comes down to a question of vaccine availability. If the vaccine is there, we would like to use it. The more that we can get, the quicker we can get it, the more people will get vaccinated during the cold Victorian winter.
What do you think needs to be done to turn around public perception of the vaccines?
Look, I think certainly the people who, I think the almost 2 million Victorians that have been vaccinated, I think on the whole are really positive about the vaccine program. They've started that vaccination journey. We will see, particularly over the next few weeks, a big increase in the number of people who've completed both doses of a vaccine. I think that's a really important story. I absolutely understand that people will be concerned, particularly about the changing guidance around Astrazeneca, and that people will want more information about that. And I'd urge anybody who's got any concerns about AZ and what's right for them, go and talk to your GP. Your GP is best placed to give you that advice. But look, I think for all of us, and I think both at Commonwealth level and here in Victoria, vaccination is the only way out of this thing. We have to get as many of our population vaccinated as swiftly as we can, and as soon as the vaccine is available to do that, we'll do our share.
Jeroen, do you think you just said people will have concerns and they'll want more information. So do you think it's worth having an education campaign?
Absolutely. I think we'd always like to see more information out there, and I absolutely understand if people are confused or just not sure about what does it mean for them now. And I think we've tried to keep this as simple as possible as we can within Victoria. We are at the point where we've seen the queues outside our vaccination centres. We've seen the demand at the call centre. We've seen the demand even online. I have no first dose slots available this week. I've got no first dose slots available next week. So we know the demand is there for people to get vaccinated. But as we go forward, we will need to continue to inform and guide Australians around what the options are around vaccination, what's right for them, to make sure people have got as much information as possible. And I don't think, as we've seen in other countries, you can't communicate too much about this.
With the big jump in the number of QR code check-ins, if we'd had the mandatory before this month, do you think the duration of this outbreak would have been abbreviated?
Oh, look, I think that's a you'll never really know, right? I mean, it's a slightly complicated question. I think what I will say is, QR codes are essential. We've seen this in the latter end of this outbreak, where I think only last week, we used QR code information from some of our recent exposure sites. We directly SMS people to say, we think you've been here, you need to come forward and get tested. We saw the results immediately at the testing centre. So it absolutely continues to speed up and increase the velocity of our contact tracing response. It's a really welcome step. Look, we've been building this up over the last 5 or 6 months. So we've used QR code information back in February, March, April, and so on. But we're seeing, the more we see people adopting it, and the more we see Victorians using it, the more confident we get that we've got all the information we need, rather than just a subset of it.
Given this is our 5th day in a row of one or fewer cases, do you think it'd be likely we'd see crowds back at the AFL in Melbourne this week?
Oh, look, that's a matter for the Chief Health Officer. I'm just the logistics guy that runs the response. So look, it's absolutely a matter for Brett and the public health team. Look, they're reviewing the situation day by day, and look, they were in working all weekend, looking at the changing situation both here in Victoria, looking at the changing situation interstate, and as we saw last week, these things can turn very quickly. We are now on a really good trajectory with the parts of the outbreak that we know about. As we saw last week, we still saw a couple of strange new cases coming out that we hadn't anticipated. We've got those now well under control, and I'm pleased about that. We'll have to wait and see what comes up to meet us in the next couple of days, and to see what judgments Brett and the team can form around how to go forward.
Do you know
roughly how many people there are who are eligible to be vaccinated but haven't come forward yet, and roughly what their age group is?
I'd need to take the details of that question on notice, and happy to give an update over the next few days. Look, I think broadly speaking, in terms of our total cohort, around half of all adults in Victoria are now eligible to get vaccinated. We've done around 1.8 million doses in total. There's around 2/3 of those over 70 have had at least one dose of vaccine. 45, getting on towards 50% of those between 50 and 69 have had at least one dose of a vaccine, and around a quarter or so of those between 40 and 49 have had at least one dose of a vaccine. So we're making really good headway into those eligible groups. The trick now will be to make sure that people who've already had one dose of vaccine make sure they get their second. And for both the Pfizer cohort and the Astrazeneca cohort, that's really important. And then we've still got a third of the way to go with the over 70s, still halfway to go for the over 50s, and three-quarters of the way to go with the over 40s. So there's a fair bit to go. And again, it goes back to why the urgency needs to be there, the momentum needs to be there. And look, none of us wants to see Jeff Shed and the exhibition building anything but busy at this point in time.
How much demand are you seeing for AstraZeneca at the state clinics, or conversely, how much availability is there?
Look, there is plenty of availability of AstraZeneca at the moment. So, AstraZeneca here in Victoria continues to be available to those aged 60 and over. It is available to those, it's accessible to those under 60 if they wish to do so, and there's a consent process involved as part of that. AstraZeneca is available by appointment. AstraZeneca is available by walk-up. So you can walk up today to get your AstraZeneca. People need to listen to the advice from ATAGI and to your GP, not from me, but absolutely all their advice is AstraZeneca is a safe and effective platform for those aged over 60. And I would encourage anybody, we've seen with the outbreaks that we've been dealing with here for the last 4 weeks, we're seeing it with the smaller outbreaks in New South Wales and Queensland, that we're not out of the woods. The risks of outbreaks reoccurring and flaring up is very real, and the only protection is having a vaccine for you personally and for those around you. So I would encourage anybody who's thinking about it, get advice from your GP and get it done.
So we've got enough supply of AstraZeneca, but you were saying so people 70 and over, about 2/3 of them have been vaccinated.
Yep.
What's the hold up there? Do you think we're now getting down to this rump of people that are hesitant to get it, or is it still people from certain settings filtering through? How do we get through that final 1/3?
No, I think if you look around the world at vaccine uptake, the first 50-60% is in most Western countries is pretty straightforward. People have a desire to get vaccinated, and people understand the risks and benefits and are willing to go forward with that. As you get to 60% or so and beyond, it starts to get a little bit sticky, and people justifiably need to understand a bit more what it means for them personally. They may have other health complications, they may have a whole bunch of other things they want to explore, and those are sensitive and important and delicate conversations that need to take place. My only encouragement to older Victorians is if you're over 70, if you're over 50, even if you're over 40, don't ignore it. Just engage with the discussion. If you've got concerns, talk to your GP. Get the information you think you need so you can make an informed decision for yourself. But we can't afford to stay in denial mode. We need to move on and get ourselves vaccinated. And with limited amounts of Pfizer available, but decent supplies of AstraZeneca available, we just want to get people who are eligible vaccinated as fast as we can.
And how's it going with AstraZeneca at GPs? Do you get figures from them? Has that accelerated the number of people getting that at GPs? Has that slowed down in recent weeks?
No, look, I think if you look at Victoria's vaccination performance over the last few months, we've done 1.8 million, 1.9 million doses in total across the state. About half of that's through the GP clinics, about half of it's through the state clinics. So the GPs have done a phenomenal job in the last 2 months, building up that complicated vaccination program, running it at rest of all the other things that GPs do. I think there's real unease now amongst our GP colleagues around what the AstraZeneca decision from ATAGI has, what that means for them. And I know there's a lot of people going into their GP asking, deeper searching questions and needing to be convinced a bit more. So I think this will be a bit of disruption. I think our Commonwealth colleagues have indicated the same, that they're expecting a bit of disruption over the next few weeks. Again, all I can do is ask people to please keep going with the conversation. If you're in a position where you're eligible to get Pfizer now, you weren't before, then come forward and get Pfizer, recognising we're constrained in how much supply we have. If you're still over 60 and you still have access to AstraZeneca, then I'd encourage you to take it if that's what you and your GP think is the right thing to do.
Have you heard reports that nightclubs have been operating dance floors over the weekend?
No, I didn't go, so I don't know. It's unknown to me.
If they were, what penalties would they be facing?
There would be, yes. I mean, there are very clear directions the Cho directions have been very clear, and I think, very carefully weighted in terms of what are the things that we can enable to move forward and what are the things that we feel we need to hold back, and Brett talked to that last week. So look, any business which is trading when it shouldn't be will absolutely face enforcement actions and appropriate penalties, and it would be a very disappointing thing to find given the sacrifices we've all had to make, and those are incredibly difficult decisions for our public health team to make, and it will be scant justice that if we're holding back some businesses to enable others to go forward if that's then breached.
Advice to school holidaymakers itching to get out of Victoria, perhaps heading to New South Wales?
Well, look, I think there's no. I think in terms of, obviously it's difficult for all of us with school-age children. People are desperate for those holidays and for those breaks and to have some real downtime. There are a number of places you can still go to at this point in time, so there are no restrictions now at the Victorian end in terms of where people might choose to go. I think people should be a little bit concerned about potentially travelling certainly into Sydney, given the number of LGA areas there that have orange zone conditions, and we've seen in the past that those can switch in the wrong direction. So I would be very cautious about putting yourself in at that risk. That still leaves huge parts of New South Wales, South Australia, the rest of the country where people can travel to quite freely, and I'd encourage them to do so.
What about travel around Victoria? Do you think holidaymakers can be confident about booking accommodation and the like, heading regionally or for those coming into Melbourne?
Yeah, look, I think within the confines of the existing restrictions that are still there, and we've made a real point around removing a 25-kilometre restriction last week. That's no longer a tie on people, so I would encourage people within the confines of the directions that are there, the restrictions that are there, to make full use of the freedoms we now have. It's a significant step change that we went through last week, and the Chief Health Officer will keep reviewing what other options he's got going forward. So I would take the freedoms that we have at the moment and make best use of them if you possibly can.
What's the current status of vaccinations for residents and workers in aged care? And do you think that visitation should be allowed in the next few weeks or days for aged care?
Yeah, look, a visitation, I'll leave that to Brett and the Chief Health Officer to decide what's appropriate there. Look, in terms of vaccination progress, certainly within the public sector residential aged care system that I see regular reports on, we are at 87% of residents being vaccinated. The remaining residents tend to be the ones who do not want to be vaccinated, or their decision maker doesn't want them to be vaccinated, and we respect that, of course. I think staff vaccination rates are pretty good, and I can give you an update on that in the coming days, but staff vaccination rates continue to rise. We ran the aged care and disability care staff vaccination drive a few weeks ago. We saw 15,000 workers come through to get vaccinated, and we continue to provide vaccination updates through our health services.
How many first doses of Pfizer are you planning to give out this week?
I would need to come back to you on that. I think there's around 20,000, 30,000 first doses of Pfizer booked in for this week.
The 8 people in hotel quarantine today,
Yep.
Does that include a family? Why are the numbers so high? Are you concerned about that?
Yeah, the only information I have, and obviously I'm not close to the details of the hotel quarantine system, but the information I have overnight is that there are 8 new positive cases in hotel quarantine. One of those is a travelling party of 6 people. I'm not aware of the relationships between them, who all turned positive on day 0. And again, it is a significant one-off increase in hotel quarantine numbers. I think we have 26 active cases now in total in hotel quarantine, and it highlights again that really important role that all those involved with hotel quarantine play, both here and in other states, around holding back the wave of COVID that is out there outside of Australia.
Do you know where they flew in from?
No, I don't, I'm afraid.
QR codes, are you still seeing breaches?
In terms of?
Businesses not following the rules, not having
Yeah,
a
no, we
system?
are. Look, we've got significant now enforcement teams and business support teams out there working across all sectors and to ensure that businesses understand the new restrictions and directions that they're operating under. QR codes is the biggest shift, and I think certainly my personal experience of travelling around the city and bits of Victoria is that businesses have really stepped up significantly. I'm now really being asked very often about whether I've checked in. So I think it's a very, very positive sign. But the purpose of those enforcement teams is to go out and to make sure that all businesses are doing so consistently, and to remind those that aren't doing it to do it well. You saw at the weekend some enforcement action taken against a small number of businesses, but those who had no QR code systems and none of those protection measures in place. And we won't hesitate to do that, but our preference is to ensure that people understand what they need to do and to encourage them to do it well.
Yeah, do you know exactly how many and I guess what type of businesses are more typically being
Yeah,
caught?
I don't have details on that with me today, but happy to brief you on that in the coming days.
And how long are businesses shut down for breaches?
So look, it depends on each case. So certainly, if I go back to the dance floor question from earlier, if there are nightclubs who've been operating, they'll be shut down. Not least because they shouldn't be operating at all at the moment. So they'll be shut down until such a time as those restrictions ease again. Beyond that, if there are businesses that are being closed because they have no functioning QR code system, they have no functioning COVID-safe plan, they'll be closed at least until those things are back in place and they get authorisation to open up again. Look, I think, and again, those are the exceptions. I think what we've seen over the last few weeks, what we've seen over the last months, even year, is that business on the whole has asked for clear direction and guidance, and where that's been given has adopted it really well. And I think we've been really reassured by our engagement with business peak bodies and other groups that they've really welcomed the directions and the changes that we've made. They welcome the simplicity around the QR code system, and on the whole, people are kind of embracing it and saying, let's just make this work, make it part of the fabric as to how we run our stores going forward. And people who do that, I think, are finding it a much easier thing to do than they would have expected.
Who actually hands out the penalties? They authorised officers?
Yeah, so we have authorised officers who are out there essentially providing that service. They work closely with teams from WorkSafe and other similar types of organisations.
Just in terms of the Pfizer supply and what we're giving out, Jeroen,
Yeah.
20 to 30k this week is about a third of what we were doing a few weeks ago, you were saying. So did we overcommit on first doses?
No. This has been. I'm not quite sure why this cat's still running around the floor. I mean, it's been around for a while now. This kind of furphy around, who's been using first doses for second doses. We've always had a really clear program. We've had a as you know from these conversations, we have 4 to 6 week visibility from the Commonwealth around weekly dose allocations. We were encouraged, actively encouraged, and rightly so. We absolutely welcomed it to use as much of our allocation as possible to help us with that. The Commonwealth published weekly performance figures about how many doses are being used. Nobody wanted to be accused of storing up or stockpiling vaccine in the background. So the encouragement was always to get the vaccine out there. We always knew as a direct result of that over the week that we're in now, this week and next week in particular, we'd face a bulge of second doses coming forward and being eligible. So we've deliberately run down our first dose access this week and next week in order to allow those second doses to be done. And we've got no qualms with that whatsoever. So I'm very relaxed about having to temporarily slow down first doses while we get to that bulge of second doses that are due this week, next week and the week after. Where we do have concerns is that net, we want to get back to vaccinating, 50, 80, 90, 100,000 Victorians a week as soon as possible. And at the moment, the forward allocations indicate a net reduction in vaccine available to Victoria from the beginning of July through most of July, and we suspect into August, and that is of a real concern to us.
So by this time you're expecting that the first doses were going to go down to 20, 30k, or were you expecting to get more supply from the federal government to keep the first doses at that level?
Our operating plan was always to reduce the number of first doses last week, this week and next week to deal with that surge in second doses that we had predicted and expected and that we have the vaccine available for, and then to return, but then to go back into that curve where we're running 100, 110,000 or so doses every single week on Pfizer across first and second doses. So, the Victorian clinic system, the system we've set up allows us to run easily. We've been running at 100, 110,000 doses a week for Pfizer for the last few weeks. We've demonstrated the ability to do that, and we could do more than that. Our frustration is seeing that number of 100, 110,000 a week drop down to 80,000 a week in total from the beginning of July. So at the very point where the winter gets darker and deeper and colder, we're being asked to reduce the throughput in our vaccination clinics, and that's something we would like to avoid. Absolutely recognise, and I think the work that the Commonwealth team is now doing to really get to grips with the programme, to get granularity on the programme. Everybody wants to get vaccination moving as quickly as possible, and certainly the Victorian position is we've got a demonstrated capacity to do that. We don't have to build a new infrastructure to do that. We don't have to make empty promises. We can deliver that now. And as much as vaccine is available, we would like to use it to get it into Victorians' arms where we think it is most needed.
Do you think, considering the demand here, and because we're in winter and perhaps what happened last year too, that vaccines set out for other states or territories should be diverted to Victoria?
As I said last week, I mean, I absolutely recognise it's an invidious job to be in the Commonwealth to have to prioritise across different states, and there are hard ways of doing that and there are easy ways of doing that. I absolutely recognise that, and I'm not going to go there in terms of what's the right way to do that. All I can do is make the case for Victoria. And in the same way as we're supporting our colleagues in New South Wales and Queensland with the outbreaks they're dealing with at the moment, this is an Australian agenda. Successfully crushing the outbreak we're dealing with here in Victoria, and I think we're on 95% of the way through it. Crushing that is a thing you do for all of Australia as well as for all of Victoria. It's a really important thing. The New South Wales team dealing with their outbreak is a thing they do on behalf of all of Australia, and similarly our colleagues in Queensland. As is vaccination, you vaccinate those areas where you've got the most risk, because all of us want to live in a COVID-free state. And to do that, you put your resources where the risk is the greatest.
Jeroen, is there an update on those missing sailors from Geelong last week? We understand all the remaining crew members were tested. Do you have the figures on what those results were? And
yeah, all those crew members tested negative, I think, last Monday, from memory.
How many
they were all tested. They all tested negative, and the boat has left.
How many people were tested?
I think it was 19 from memory. I'll come back to you through the team if that was wrong, but I think it was 19. Sorry?
Are you concerned about testing rates, the fact that they're quite low?
No, not really. I mean, I think we were, 17,000 for yesterday, again for a Sunday. That's a very healthy number compared to, if you go back 4 or 5 weeks, we were running single figures for our weekend days. So if we can sustain that 17,000 number for a weekend and bring it to maintain high teens, ideally low 20s during the week, that'd be a really good result. We'd like to sustain that level of testing engagement. And again, but if I look at the outbreak as a whole, I mean, 850,000, over 200,000 a week, every week for this 4-week outbreak has been an astonishing result. We've to paraphrase other colleagues, we've taken testing to a different level over the last 4 weeks here in Victoria, and it's been great to see people coming out in such numbers. We're all going to have to find a new normal, and I would absolutely encourage all of us as we start to move around a bit more. You should absolutely use any symptom you have as a spur to go and get yourself tested. There are no waiting times at our testing stations now. You will have your results well within 24 hours. This has to now become part of our normal way of doing business.
Just on that, do you have any idea about how successful the program has been for people travelling to the snow?
Yes, look, I think we've had some good reports, and certainly support from the Alpine resorts in terms of ensuring that people who are coming into the Alpine resorts over the last weekend in particular, they complied with that negative testing requirement. I think a small number of people, and I mean literally a handful, were turned back who didn't have that or weren't able to evidence that they'd had a negative test before going to the snow, for the reasons that Brett went into last week. So, look, I'm grateful to the Alpine Resorts for taking on that additional step to ensure that people coming into their resorts are COVID safe and can enjoy themselves when they're up in the snow. And obviously, we'll continue to maintain that over the days ahead.
And if you think this is a successful program, will it be used in other kind of domains?
Look, I think we'll see. I mean, look, our preference is always going to be to ease off restrictions as safely as possible and in a way that allows people to move around again, and we don't want to put artificial barriers in people's way of doing that. I think the decision that the public health team had to balance for the Alpine Resorts was it is a higher risk location, so that extra step of putting a test in place was a way to enable them to get people back in there earlier than we otherwise would have done. But I think we would see those kind of arrangements being in place for very special circumstances, rather than ending up with a whole range of applications where suddenly people have to go out and get testing for a whole range of other functions. So, we'll obviously watch that case with interest, and I think it'll be interesting to see what the numbers have been at the Alpine Resorts as to whether that's been a successful thing or not. Okay, good. Thank you all very much indeed.